Hello my viewers, welcome to Returnach Organic Healthy Tea. If it is your first time, please feel at home, do subscribe, click on the notification bell, and please feel at home. And for the old ones, I welcome you once again. Feel comfortable, feel at peace, cause we are actually going to share more about health and nature. Today I want us to share about diabetes. I know diabetes is one of the most disturbing illnesses or diseases among this generation, and that's why I actually want us to look about it and see how far we can go about it. Diabetes is a chronic metabolic syndrome that actually affects how our bodies turn the food we eat into energy. Most of the food that we eat is actually converted to energy, glucose, that actually is released into the bloodstream and utilized by the body cells to do what? To provide us with energy. The produced glucose or sugar released into the bloodstream has to be removed from the blood and taken to the body cells to utilize them so as we actually get energy and to carry out other body metabolic processes. However, if the blood sugar or the glucose in the blood rises above normal standards or normal levels, it becomes actually deadly, and it leads to this condition or an illness called diabetes. How can you know that you are actually having diabetes, or whether your blood glucose or blood sugar level is normal or abnormal? For a person with a fasting glucose level of less than 100 milligrams per deciliter of blood is actually considered to be having a normal blood glucose level. A person having 100 to 125 milligrams of glucose per deciliter of blood is actually having pre-diabetes. That second stage, or the first stage before actually one is considered to be having diabetes. And actually that person has to watch out and take the necessary precaution to actually reduce or overcome pre-diabetes, as it, if not treated, can actually lead to diabetes or cause severe damage to the body. Untreated pre-diabetes for a long time can cause damage to the body nerves, the blood vessels, as it can lead to damage and increase the risks of heart diseases and conditions like heart attack, stroke. Untreated pre-diabetes can also lead to damage of the tissues and body organs, like the eyes can be damaged, the kidneys. One can actually start getting slow healing or non-healing wounds. Let's look at the diabetes. A person is considered to be having diabetes when he or she has a fasting glucose level of 126 milligrams per deciliter of blood or higher than that on 2 separate tests. When that person is actually tested for 2 or on 2 separate tests, and his or her blood sugar levels, when that person has fasted or has taken like 8 hours without eating anything, and the blood glucose or the blood sugar levels are 125 or 126 milligrams per deciliter of blood or higher than that on those 2 consecutive or on those 2 different tests, that person is actually having diabetes. Let's look at the types of diabetes. Actually, diabetes is separated into 3 types according to the cause and period. And according to the cause, we have type 1 diabetes and type 2 diabetes. According to the period, we have gestational diabetes. Let's look at, but before looking at type 1 diabetes, there is also hypoglycemia. Hypoglycemia is also a condition related to diabetes where the blood glucose level is actually very low. It is actually below the normal required glucose level. Also, that condition is also harmful and not good for our health. Though we don't need to have a lot of sugar or abnormal levels of glucose in our body, in our bloodstream, we also don't have to be with very low levels, but we shall later on look at hypoglycemia later on. But for this time, let us digest about diabetes. Type 1 diabetes actually occurs as a result of the body gaining autoimmune immunity, whereby it mistakenly attacks itself and stops the production of insulin, which is the required hormone for regulating the glucose levels in the blood. So if it stops the production, definitely the glucose levels in the blood are going to increase beyond normal as one keeps on consuming food. Type 1 diabetes is actually diagnosed or commonly diagnosed in children, teens, and young adults. And it can actually not be prevented, or its preventive measures are not known, because the body just comes out of the blue and starts attacking itself and preventing the production of the required hormone, that is insulin, required to regulate the blood glucose levels. Let's look at type 1 diabetes. It is actually the type of diabetes that requires one to be dependent on the insulin on a daily basis for survival. It is where we see individuals injecting themselves with the insulin, as their bodies cannot actually produce the required amount of the hormone. Looking at type 2 diabetes, actually here the body does not utilize efficiently the produced insulin, and thus leading to the rising of the blood glucose levels above normal levels. This type of diabetes can actually be prevented. It can be prevented or delayed by healthy lifestyles, and like changing our diet, eating healthy food, making our bodies active, like indulging in physical exercises, managing our body weight, and many other steps. Thirdly is the gestational diabetes. Gestational diabetes actually occurs in pregnant mothers who have never had diabetes in their life history. It just develops as one is actually pregnant. I know you very well know that pregnant mothers actually observe increased appetite during that period, and they end up not regulating what they eat, hence developing diabetes. Other factors held constant. However, this type of diabetes can actually go away after giving birth, but it can increase the risks of type 2 diabetes, where the body is not actually utilizing the required the secreted insulin. So when you have gestational diabetes during pregnancy, you actually have to watch out when you have given birth. Check out with your doctor, as you never know, you might have type 2 diabetes, as the former did increased your risks of type 2 diabetes. This gestational diabetes can actually increase the risks of the baby having obesity as a child or as a teen, and can also develop type 2 diabetes in the baby later on in life. Let's look at the signs and symptoms of diabetes. Signs and symptoms of diabetes. What are the indicators? What can you see or feel and actually come to think of diabetes? Come to think of asking your doctor about doing a test or two of diabetes. Actually, diabetes damages our nerves, hence leading to increased numbness and unsensitiveness in the body extremities, like the fingers, the feet, the hands, the legs. As I've told you earlier, it increases the flow and supply of blood and the required nutrients to those body extremities, and eventually leads to the damage of the nerve fibers. Numbness from diabetes actually presents as a prickly or tingling or painful sensation that starts out as minor at first, but later turns to be painful and chronic as nerve fibers go on being damaged over time. And this numbness can actually be accompanied by muscle wasting in the body extremities, where you will observe your fingers becoming smaller than the usual size, your toes becoming smaller than the usual size. Actually think of checking out with diabetes. Another symptom is increased urination. You actually feel increased urge to urinate, and the amount of urine passed out is actually large or larger compared to the normal or usual quantity. And this condition can actually lead to dehydration as the body is losing too much water than usual, and it renders the person to several diseases and illnesses like kidney diseases and decreased immunity. And thirdly, diabetes can be indicated by abnormal or unexplainable weight loss, where someone actually rapidly loses weight because the body cannot absorb glucose properly. And this actually mainly occurs in type 2 diabetic people, and even in the undiagnosed patients with type 2 or type 1 actually show this sign and symptom. The unregulated insulin hormone begins to burn the fats and the fats in the muscles as a source of energy. As it is not getting the glucose, it ends up burning the fats already stored in the muscles, hence the loss in weight. And diabetes also can be indicated by increased blood pressure. The blood pressure rises as a result of high density of blood, as the glucose levels are high in blood circulation decreases, blood flow decreases, blood becomes thick, and hence the failure to move properly into the blood vessels. And it actually requires the body or the heart to incur or to exert much pressure so as to move the water, so as to flow the blood to the body parts, hence the increased blood pressure. Fourthly is the increased appetite, where one actually feels hungry even after a meal. The increased appetite actually makes one consume more calories than the body requires, and this can later lead to increased body weight. You can put on weight, and it can also lead to obesity. Why? Because of the increased appetite. Actually, some people are very happy because they feel they can eat whatever they want, but not knowing that it is actually a sign of diabetes. Another symptom is poor vision. Diabetes actually decreases vision, and it can lead to blurry vision or total blindness in type 2 diabetes. It occurs as the blood glucose levels increase, leading to sugar spikes that end up damaging the blood vessels in the eyes and restricting the flow of fluids to the eyes, which end up actually leading to poor or blurry vision. Itchy, dry skin is another symptom and sign of diabetes. Actually, type 2 diabetes can affect every part of the skin. It can affect every part of your body, be it the skin, be it the liver, be it the heart, be it the blood vessels. It is actually not good. It is deadly. So it requires one to actually be sensitive of it. When you see the itchy, dry skin and other signs, please check up with your doctor and try to actually know whether it is diabetes or what, as we have seen that it actually damages many of our body parts and organs. The itchy skin actually occurs as a result of poor blood circulation, which leads to the dysfunction of the sweat glands, hence leading to a dehydrated, itchy and irritating skin. Undiagnosed diabetes may actually render the skin to fungal infections, diabetic blisters, bacterial infections, and boils, fingernails and toe infections, among other skin diseases. Unexplained fatigue is also one of the signs and symptoms of diabetes, where actually blood becomes very thick and sluggy, hence the decreased circulation that prevents transportation of the vital nutrients and oxygen to the body cells, which lead to exhaustion. This can also occur in hypoglycemia. I remember I've talked about hypoglycemia earlier, where the blood glucose decreases very low or below normal levels. When actually one has low blood glucose levels, that person can get the unexplained fatigue, feeling tired all the time without doing anything. One feels tired. That is a sign of both diabetes and hypoglycemia. In hypoglycemia, it occurs as a result of low blood glucose levels in the blood, where the body is actually not able to obtain enough glucose for energy purposes. Unquenchable thirst is also a sign of diabetes, as It occurs as a result of increased urination, as well as increased amount of urine that leads to dehydration. And the body actually demands for more replenishment. It needs to be replenished or refreshed, hence leading to severe thirst, or hence making you feel thirsty every now and then. Also, undiagnosed blood sugar levels or diabetes can cause the unquenchable thirst. So we should always be sensitive or be aware of why we are feeling thirsty all the time, as it might be an indicator of diabetes. Another symptom or sign are the slow healing wounds. It actually occurs as a result of decreased blood circulation, where blood and other nutrients are not reaching the body parts or the body organs as it must be, leading to slow healing wounds. Like, for example, when someone gets damaged, the required vitamins and the required hormones, the required enzymes and nutrients for blood clotting, for wound healing, are not actually transported properly to the damaged part or area, hence leading to the slow healing wounds and bruises. Another aspect that we can talk about in that corner or in that line is the blood vessel damage. The blood vessels actually become damaged when someone has diabetes, and also that hinders the blood flow to the damaged area. It also hinders the blood flow to the damaged area. Another symptom of diabetes, you can actually start getting irritating gums. Actually, in type 2 diabetes, we can find people actually suffering with their gums. Someone can start getting blood or bleeding gums. The gums can start swelling, reddening, and irritating. Sometimes actually the gums can start receding from the teeth, and this is actually as a result of one being with diabetes. Another symptom is the dry mouth. Dry mouth is actually a symptom or a sign of type 2 diabetes as well as type 1. Due to increased blood sugar levels and dehydration, one actually starts getting the dry mouth as the saliva and mucus levels decrease, because the body is not having enough it is not hydrated. It is dehydrated, and the blood itself is very thick with sugars. Of course, the saliva has to do what? To decrease, hence the dry mouth. And dry mouth is accompanied by dry lips, rough and tough throat, difficulty in chewing,